Good afternoon. This is take two. I had practiced on my iPhone at home and it worked, but it didn't work here. So, plan B. I am Marylee with United Stroke Alliance, and we are about the prevention, the awareness, and the recovery from stroke. And I am more than thrilled today to have with us 4 students who are going to talk about not giving up on therapy. So I'm going to turn the camera around, let them get started, and if you have any questions while we're doing this, please put them in the notes, and I will try and ask the students, and they will answer as best they can. So I'm turning the camera around, and ladies, take it away.
Hi everybody. So we're all students at OSF St. Francis in Peoria, Illinois, and we're a mix of OT and PT students, all in our last rotation before we graduate. So my name's Callie. I'm from Minnesota, and I go to St. Catherine University.
My name's Lauren. I'm from St. Ambrose University, and I study occupational therapy there, and I'm currently at OSF on Sheridan Road.
And my name's Haley. I'm actually from Massachusetts. I go to the University of Massachusetts Lowell there. I'm a physical therapy student. Maddie and I work together at OSF St. Francis in the neuro, ICU, and the general and intermediate floors.
Yeah, and my name is Maddie. I'm also a physical therapy student, and I'm from the University of Indianapolis. We figured we'd start out with just telling you a little bit about our 2 professions and the differences and similarities between them. So for us, physical therapists, our main job is to help improve your movement, mobility, and function. So we can help you improve or restore your strength, your range of motion. We can help decrease pain, prevent complications, or prevent conditions from worsening, and then just educate you on how to improve your overall fitness level.
And for occupational therapy, or OT, we help you perform daily tasks that you do every day. And the word that occupation, people get caught up on that a lot, and they're like, oh, I don't need help getting a job, but it's a lot more than that. So in the OT world, occupation is anything that takes up time during your day, all those things that you need and want to do. And we'll get down to the nitty-gritty a little bit later about what those occupations are.
So some similarities between PT and OT: both improve overall function, quality of life, and provide knowledge on how to maintain good function, health, and well-being. We serve people with similar conditions and diagnoses, and we're hands-on in the way we teach different tasks and exercises.
Yeah, so that's kind of what PT and OT are and how we work together. But after a stroke, the main goal for therapy is to restore your function, to relearn the tasks and skills that you were doing before that you can relearn to do now, either in the same ways and just getting stronger and getting that motor back, or in new ways that might look different but help you achieve the same functional goals. And it's really so that you can continue to live a fulfilling life and do the things that you enjoy, and improving your independence so that you can do things yourself, maybe with adaptive equipment or in different ways, so that you don't always have to be relying on someone else. So the rehab process really starts within the first day or 2 of having a stroke. And now we're gonna go through basically the continuum of the rehab journey that happens after a stroke, that begins in the hospital and goes all the way for the rest of your life to help you maintain your physical fitness and do the things that you love. And basically it's just helping the brain relearn all those skills in newer, different ways.
Yeah, so in those first few days, you'll see a physical therapist, and we'll come in and we're just gonna help you kind of get out of bed for the first time, hopefully, and start moving. So we'll help you improve your function, your strength, your endurance, and then mainly just prevent complications from prolonged bed rest and immobility that can often occur when you're in the hospital for a longer period of time. Yeah.
I have a question. one of the followers has a question.
Great.
Do I remember correctly that you start with an assessment of
Correct.
where they are?
Yeah.
And this is just random. I remember my husband being frustrated. He had such bad aphasia that he didn't know what people were doing.
Right.
And so as a supporter, as I am, I would clarify, can you tell us why we're doing this, so that there wasn't the frustration.
Yeah, it's understandable because when you're just found out that you've had a stroke and you're in the hospital and you have all these people doing all these things, it's understandable that it can be frustrating. But for us, the biggest thing is to kind of figure out not only where you're at now in your mobility and just functions and how you do things, but also we need to learn what you're doing prior to your stroke, things about your life, so we can take that all together and figure out what's the best process for you to go about with your rehab. So for physical therapy, we obviously will do an evaluation, and we'll talk about that in a little bit and kind of figure out like if there's any devices that you need. OT is kind of similar.
Yeah, so we kind of do a lot of the same things during our assessment, so it gets really repetitive. And every time I go in to see a patient, I'm like, I'm sorry, I know you've already done this 1,000 times, but just bear with me, because the way, like, Maddie could see a patient before me and do all the exact same things, and then I come in, but we're looking for different things in OT versus PT.
Yeah.
And doing that evaluation is really gonna, like she said, tell us like where you were before and where you're going in the future.
Yeah, so like when we come in and evaluate, we're going to ask a lot of questions and have you do a lot of things, and it'll help us just kind of tell how alert you are, your cognition level, about your language, abilities currently, if you've had any changes in vision. Then we'll look at like your strength and all of your muscles, your flexibility that you have. We'll look if your sensation has changed at all, and then we'll also do more things like if you can get out of bed, if you can sit on the side of the bed and balance yourself, and then kind of progress that to see if you can stand and walk, if you need a device for those, and then we'll add that in with other information we get. So we'll figure out what your age is, what type of stroke you had, and how severe it was. We'll look at what other nursing needs and physician needs you may have, or other like supporting services, and then kind of figure out how much therapy we think you could tolerate, and like the intensity of that to figure out where you should go next.
Mm-hmm.
Yeah, that's exactly it. So after we figure that all out, as well as kind of like what your home setup is like and how much support you have if you have family that live nearby or with you, that helps us determine kind of where you're headed after. Once they get everything medically stable in the hospital and everything is back to normal and you're ready to really seriously focus on your rehab process, there's a few different places that you can go from the hospital. So there's inpatient rehab, which is very therapy focused and very intensive rehab. There's skilled nursing, which is kind of a slower pace, but it gives you more time to...
So the inpatient rehab,
Yep.
do I remember you have to be able to do a certain number of hours? Can
Yes.
you talk about that?
Yep,
Yeah.
I'm getting right to that.
I'm
No,
sorry.
that's perfect.
We're thinking the same
I'm
thing.
such an
Yeah.
overachiever.
That's okay, you're on the right track. Yeah, so it's kind of like there's two places that if you say you can't walk or really kind of move around without a wheelchair, but your house can't take a wheelchair, then you can go to a facility to get you stronger. So that could be the inpatient rehab. And in that setting, it's really intense. So you could be getting physical therapy, occupational therapy, as well as speech therapy to help with like aphasias and cognition and things like that. And basically you have to be able to tolerate 3 hours of therapy a day. That doesn't mean 3 hours back to back, but sometimes, especially in the hospital, 1 hour of like PT or OT can really wear someone out. So you'd have to be able to do 3 separate sessions, which is great because if you can tolerate that, it's really focused on functional movements and training for things at home, like using a walker or practicing the stairs and practicing your balance, and with OT similar things. And basically that's one option. And then if that would be too much, maybe the stroke really wore you out and you can't handle that much a day, you can go to a skilled nursing facility, which is different than a nursing home because you're able to focus on your therapies and you'll get PT or OT or speech. You just don't have to tolerate that 3 hours a day. So maybe it's 1 session a day, but it allows you to stay there longer for maybe 4 to 6 weeks. Whereas the inpatient rehab is 3 hours a day for about 2 weeks to really kind of jumpstart your therapy. or you can do the skilled route.
Yeah. So skilled nursing is less intense because it's 30 to 90 minutes a day, and it's usually only addressed like 3 to 5 days a week. But nursing and medical care, of course, is still provided as needed. And
Yeah.
like you said, you're just there a little bit longer and skilled, so you take your time to heal.
Yeah, so it basically just depends on kind of where you're at and how much you can handle, but it will focus on a lot of the same things that the hospital would focus on, like your functional mobility for physical therapy, especially getting around with maybe a new device or practicing the stairs and getting your balance back to a safe level so that you can return to wherever your next step is.
So another step in the continuum of care is home health therapy. And before we go on, you don't necessarily go from the hospital to inpatient rehab or skilled nursing and then home health and then outpatient. It totally depends on your needs, and you might skip over the rehab part if it was a fairly mild stroke. You might just need home health or outpatient therapy. So it's not to say that you're going to have this whole continuum of care. It's just whatever fits your needs and all of that.
And that's part of our evaluation while you're in the hospital, is to figure out which step you need after that.
So home health therapy we would recommend if the person is still having some trouble getting around, maybe getting in and out of their home, or would otherwise have mobility issues that would limit their ability to get to an outpatient facility to get those the therapy that they need. And this therapy is usually 1 to 3 times a week, and whichever discipline, OT or PT or both, will come right to your home and work with you in your home environment.
Yeah, so like for PT, we could focus on endurance, which is a big reason if you can't make your way out to like an outpatient facility. Part of that could be endurance, not being able to make it from your home to your car and then walking all the way in. So we can work on your endurance and your ability to move around your house better, working on your posture and just your whole walking ability. So you could be new to having an assistive device, and we can help you learn how to use that, whether it be just walking in your home, using it on stairs, things like that. Will help decrease your fall risk. And then we'll also assess your home to see if you need any home equipment, and just to see how safe your home is for you and your new level of mobility that you have.
And in occupational therapy, one really cool thing that I think we do is a home assessment, and that's where we go through your whole house or the areas that you use the most and make modifications to the environment so that it fits you better, instead of teaching you how to work better in your own environment. It's kind of a balance between both of them. So we might look at your bathroom and say you need grab bars in your shower, or you need one next to your toilet, and be able to tell you exactly where it should go in and connect you to those resources to help you install it if you would need it.
I'm going to insert a funny story.
I like it.
Please.
Well, when my husband bought the house that we live in, it was before we were married, and an older person had owned the house, but he had had a quad level house, so he moved after he'd had heart surgery, so he moved to a ranch. And it had grab bars in all the it has 3 bathrooms. It had grab bars in all the bathrooms and around the shower and the tub. And I remember thinking, oh my gosh, this is an old person house. So with John's, all of his health issues, we have been so thankful that we didn't have to modify.
Yeah.
And because God has a sense of humor, I had a little accident and I broke my foot. And I can't tell you how happy I was to have those grab bars get out of the bathtub
Right?
with a broken foot. So, you just sometimes, you have to listen. You have to pay attention.
It's funny, we talked about that. I was like, I think I'm gonna buy a house that has no stairs to enter from the outside, just in case I
You
need
would
to
think
stay.
of that, yeah.
We'll be the worst first-time home buyers, because we'll look at all of that
Oh,
and
yeah.
figure
Master
out
on the
what
main
we
floor.
Yep.
Doorways are wide
Extra
enough.
wide.
Yep.
And the things that are adaptive are so much more attractive than they used to be.
Oh, yeah.
I did a video with a gentleman that showed us adaptive equipment that's stylish.
Yeah.
And so you don't have to look like you're halfway in a nursing home.
No.
Yeah, like your grab bars can look like decorative towel racks that are
Yes.
just like very fancy looking,
Yes.
but
They're
can
pricey,
be
but they're
helpful.
beautiful.
Yes, exactly.
Okay, sorry for the interruption.
No, perfect. That's okay. So the last setting we're going to talk about is the outpatient setting. And this is really just a refinement of some higher level skills. You can be seen 1 to 3 times a week, and you can see all 3 disciplines like OT, PT, and speech, or you can just see one. There's no requirement. For OT, we can work on things like returning to work, handwriting, manipulating zippers and buttons, cooking, cleaning, like medication management, and health management.
Yeah, and then you can come for PT as well, like she said, to work on different things. So we would still focus on like your functional mobility. Some people think of outpatient physical therapy as going after you have a knee injury or like a shoulder injury, and it's the same for stroke. So we would just continue to work on those higher level tasks. So a lot of it can be strengthening on your weaker side still, or working on your balance. We can continue to train with different assistive devices. If you no longer need, say, a walker, we could help you train to use a cane or to get off of your cane as well by working on your balance and just helping you be more safe and stronger in the community to be able to do and access the things that you need to. So that's really more of a thing towards the end of your intensive rehab process that will lead you to be able to maintain your own functional program.
Do you guys know Chrissy?
Yeah, we do.
Chrissy's watching. And yes, Chrissy, the old person is John Nunley. Chrissy was his physical therapist. With his,
Okay.
And we love Chrissy with his pancreatitis, and then she reappeared after his stroke.
Oh. That is one of the great things. If you already know a physical therapist, you can go to them in outpatient afterwards as well. So, yeah.
So now we've made it through this long continuum of care, and it really does look different for every single person, and you're ready for discharge. So on an important note, being discharged from PT or OT doesn't mean that your potential to progress has plateaued. It means that both you and your caregiver have gained the skills and have been given the tools you need to feel ready and be successful in carrying out your therapy independently. As future therapists, we encourage our patients to get a PT or OT referral from their doctors if any new challenges arise after discharge. So, although your journey with PT and OT does come to an end, your journey of recovery is by no means over. Stroke recovery is a lifelong journey, so here are some ideas you can do to potentially maintain your therapeutic gains and progress after therapy. So never give up on therapy.
Yeah. So maintaining physical fitness is obviously very important for everyone, especially if you've had a stroke, because if you can continue your physical activity, it can help prevent your risk of getting another clot, which is super important. So one way you could do that is just to join a local gym. We know that Anytime Fitness and YMCAs, they often have programs specifically for individuals who have had stroke, so it's more geared towards them and things that they would need. You could also get a personal trainer and help you focus on specific things, and otherwise you could just join a local gym and just do it on your own, so using the cardio machines or the weights.
And one thing that I didn't know this until we joined Anytime Fitness, and there are trainers who have studied neuro. So there is a certified, and I didn't know this, personal trainers can get a neuro certification. So they're aware of the neurological challenges, and that there's one at Anytime Fitness, and that is just a huge blessing.
Yeah.
Because they understand that piece of it.
Yeah.
But any trainer can certainly do the assessment and work with someone.
Yeah.
But it doesn't hurt to ask.
Exactly.
That's right.
Any gyms you look at, that can be a great question to ask, because it could be more focused on the needs that you would have versus just any ordinary person.
Yeah. And one of the biggest things is just to make sure that you find someone that you're comfortable with, and that makes you want to keep moving forward and keep getting better, because a lot of times people think that because they've had a stroke, maybe they don't still have the same potential to do fitness or maintain their fitness. But actually research shows that a lot of people who have had a stroke have the same potential to make fitness gains as people who haven't had a stroke that are their same age. So just because you have a stroke in your history or you have some deficits that you're still working with doesn't mean that you can't continue to progress and make cardiovascular gains that are going to help your health in general, as well as strengthening and working on balance and other things that are just fulfilling to you. So
another benefit that when my husband was going to Anytime Fitness was when he would be there without me, his communication, he would have to stretch his communication because of his aphasia. So the socialization and this stretching that way was huge.
Yeah, that's a great point.
More benefits than you'd even realize.
Right.
Yeah.
I would never have thought of that.
Yeah, it's challenging, not just like physical fitness, but cognitive and psychosocial, more importantly.
Yeah.
Especially doing something that's meaningful to you and that makes you happy and helps you progress forward anyways. So we were talking about with COVID, unfortunately, but some of the great things that have come for it are really awesome YouTube videos or programs and Facebook groups that allow you to do fitness programs and socialization through your home. So we were just kind of talking about the different options for stroke survivors to do at home, and there's things like adaptive yoga, which you can do if you're not up on your feet as much. You can do yoga from a chair. I know that my senior center back at home offers this. And then with COVID, they started just doing a Facebook Live. So that's a great option that you can just tune into from your house and do that to work on that. There's
finding ones at the level that you're at. So there's all different types, which is great.
Yeah, and a lot of them offer modifications. So if it is standing yoga, they'll talk to you about different chair poses. And then there's Tai Chi as well, which is great for your balance and your mind-body connection, which is huge with strokes. So just finding different things that you're interested in, because there is a lot out there and a lot online recently that you can really get into.
Yeah, that is one of the blessings is that we have adapted, and we have a yoga instructor who volunteers in Phoenix. And she did a Zoom. We did a Zoom with anyone who wanted to do
even
adaptive yoga with her.
Yeah, even just Zoom ones. Haley does Zoom training sessions
I
from
do.
home. So there's a lot of opportunities from home. And even if you don't want to look for a new opportunity, if you've had therapy and they've given you like a home exercise program, you can continue doing that throughout. Even when you're done with your outpatient therapy, there's no problem with doing that. That'll definitely help. I think the most important part is, like we've said a few times, is just finding something that's super meaningful to you and that you can add into your daily routine, because if you like it, you're more likely to stick to it and keep doing it. So that's the biggest part.
Yeah. So we wanted to talk a little bit about routines as well, because like Maddie said, it's really important to work those into your routines. Otherwise, if you're like, oh, I'll do it tomorrow, I'll do it tomorrow, I'll do it tomorrow, then it doesn't become a part of your life, and ultimately you just won't do it. So it's really important to work these things into your routine, and routines can be helpful as much as they can be hurtful. So you can get into bad routines like sitting on the couch all day, or you can replace that routine with doing your daily exercise program or doing some activity that's meaningful to you and is going to help you in your recovery along the way.
So some other ways you can not give up on your therapy is by engaging in occupation. Occupations are inherently therapeutic. So you're probably thinking, what are these occupations? We said we'd come back to it, so this is us. First one is called activities of daily living. This could be anything from dressing, bathing, toileting, grooming, feeding, being able to walk around your house. The second occupation is called instrumental activities of daily living. This could be grocery shopping, so you could actually go to the store and grocery shop, or if you're unable to do that, you can just prepare a meal list to kind of help your caregiver out. You can take care of your pet and be an advocate for your own health management. So the third occupation is rest and sleep. So sleep is an occupation. It takes up a large portion of our day. So practicing good sleep hygiene, which could include setting a bedtime routine, limiting device use before bed, and limiting daytime napping. It's so important for brain health and healing. If you find yourself exhausted at the end of the day, you can build rest breaks into your schedule or routine, as we just talked about. Some examples besides napping are meditation, working on a craft, coloring, listening to soothing music. So the fourth occupation, there's quite a bit, you're probably surprised, is education. So education can be informal or formal. So just stay engaged by going to a class, watching YouTube videos, reading, or doing word games.
So the next one is work, which is somewhat self-explanatory. It's something that you do during the day to gain an income or not. This could also include volunteer opportunities, or even if you have grandkids or somebody to care for them during the day, and that can also be considered work. The next one is leisure, such as those hobbies that you like getting out in the garden or going for a walk, sewing, listening to music, watching sports, and participating in sports. And then the last one is social participation. And this is getting engaged with your family and friends, getting out into the community and participating in community activities. Just any place where you can engage with other people.
Yeah.
Somebody asked the viewers to tell us what hobbies or leisure activities to post on. Say it into the microphone. I'm not sure they can hear.
Oh, to
See if anybody on here wants to post.
Oh, yeah.
I like that. I didn't get that first.
I didn't understand. Yeah, so viewers, there's a little misunderstanding here.
I was thinking.
Post in the comments some of your favorite hobbies and leisure activities,
Yes.
so we can get to know what you like to do.
Yeah.
did you give examples?
Yeah,
Okay,
I
you
gave
did.
some
Okay.
examples
Yeah.
so that
Yeah.
like
Like
gardening.
my favorite is baking and playing with
Yes.
my dog.
Yeah.
I don't know about you guys.
I recently actually started knitting out here in
Knitting.
Peoria to stay busy. So I'm knitting, and crafting is kind of one of my favorites, and playing sports, but there's not much of that with this winter.
Pickleball.
Pickleball. I had my first pickleball experience this weekend. I had never even heard of it at home. I don't know.
I've heard of it, I've never played it.
Yeah. Like I like hiking. I like
Yes.
crocheting too.
Yeah,
So.
I crochet.
Yeah.
Really?
Yeah. And I ordered a ukulele that's coming tomorrow, so that may be one of my new hobbies if I stick to it.
Yeah. But everything is great, and we really just want to emphasize that even though you finish outpatient therapy or you finish your home therapy and you feel good and you feel like you can do things, that you should still keep moving forward and doing things that make you happy and keep your fitness up, as well as your hobbies and your social interactions, because you have the potential to create new gains for the rest of your life. You only stop making gains when you stop putting the work in to do that. So just to never give up. You can always go back if you feel like your balance is off or you feel like you need something more. You can always go back to therapy and kind of just get a refresh and get right back on the right track again. So
Any last minute thoughts?
that's it.
That's all we had.
Unless anybody has
That's okay.
Unless there's
questions.
questions.
So far, no questions that I can see. So I'm going to turn the camera around and sign off.
Okay.
Well, I had a good time. I always have fun with this. These are 4 delightful young women. And are all of you going to be back next month? And then
I am.
Yeah.
I think
We'll be back
they're
for
all
the
be
next
back-
one.
They're all going to be back next month, and they're going to do a demo with adaptive equipment. We took a look at that this afternoon, and we're going to have some fun with adaptive equipment. They probably will bring some things from the hospital, but you know me, I've got a lot of gizmos and gadgets. I think it's fun to expose people to ways to make life easier, whether you're handicapped or not.